Today, 10 million or 20% of the nation's school children are labeled and drugged. It is a heinous crime and a national disgrace. Welcome to the True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, stress, inflammation, and functional health clinician.
And I'm your co-host, Brigitte Spurgeon, metabolism and nutrition expert.
This podcast is where we bring hope, truth, and inspiration for your holistic health journey.
Because the world needs the best version of you.
Welcome to True Health Solutions podcast. I'm your host, Dr. Lonnie Bagwell, here with the
Brigitte Spurgeon.
Brigitte Spurgeon, live from Ireland. And on today's episode, we're going to tackle a topic that is near and dear to everyone's heart. Actually, it impacts everybody because at some point, you either have children or you've been a children at some point in your life. And so today we're going to talk about healthy kids and just give you some. Actually, we're going to present this in two episodes. We're going to talk about changing our mindset around, the sickness that we're dealing with and 21st century disease as it pertains to children. And then in the next episode, we're going to dive into the solutions, right? And so this will be a two-part episode. And really, the time of the year, I think, spurs this topic for us every single year because we're going into August. We're going into, back to school. And that raises a couple of things related to health. It raises stress issues, right, for the whole family, major schedule changes, which is a disruptor, right, to everybody's mentality this time of the year. Eating schedules change, right? Now we have busy school schedules that change, diet and food. We have lunches that we need to talk about. We have kids going into emotional stress and, social relationship stuff. There's just no end, to the, just this bomb goes off every August, September. And so we want to take it head on like we do everything else when it comes to health. And from your perspective, Brigitte, I know, stress, nutrition, taking a significant dive, that's going to create an uptick in, obesity or weight related issues, of course, at the same time for both parents and children. And so these are all the things that we're going to talk about on today's episode and talk about solutions on the next episode. And so one of the big things, kind of overall 30,000 foot view, that I've come to realize with more clarity. And as we teach through heart disease, cancer, diabetes, and all the different topics that we've recorded podcasts on, or we teach workshops on, the issue, the kind of global idea here is that all of the mistakes that we've made, now our children are paying for. And that can be summarized in one statistic, which is that our children, for the first time in history, our life expectancy is actually going down. So all the years of people saying, oh, but we're living longer, well, that's not even true anymore. So now our children are going to live less time on Earth for the first time in history. That's going backwards. And that's not because of anything that they've done. That's because, we've gone through the decades of better living through chemistry. There's a pill for every ill. I think each decade can kind of be given some kind of cliche label, for all of the things that create an equation that adds up to, okay, we're now going down. And that's also and this is so ridiculous because no one listening to this would agree with this statement, but when the life expectancy is going down, it's like saying that we are now the pinnacle of health, for modern society. And now it's on a decline, which is ridiculous because we're the sickest in history, right? We create more disease than ever in history. So any comments on that before we dive into any of the specifics when it comes to what we're encountering or what our children are encountering?
I think even just saying this right now, the parents listening, their stress is just starting to go up because it can be so overwhelming. It's so overwhelming because you're not only making decisions for your own life and your health and your finances and your time, you're making decisions for your kids. And that's exactly why we're doing this podcast, is to support you on that journey, to know that you're not alone and to provide resources for you. So we're so glad that you're listening today. And our goal is to lessen the load, to equip and empower you to be, like we say, to be the best version of you, to be the best mom, the best dad, to be the best that you can be. And so part of that is helping your kids be the healthiest versions of themselves.
Yeah, legacy, right? We talk about that a lot, and we want to, and everybody would say, I want my kids to be healthier than I ever was, or better than I ever was, or all those things. And just like we would say, health is one of the most important things in our life, if it's not our top priority, right? And yet, unfortunately, statistically, and because of this podcast, we can't say that we don't know better, right? Because of the teachings of the office, we can't say that we don't know better anymore. That's why we're teaching so much. But we have to just accept the fact that statistically, we're leaving this incredible negative legacy, when it comes to health. And it mostly comes down to personal responsibility. We'll talk a lot more about that some today, and definitely on the next podcast. But right now, like, one of the crazy stats, like, this is what we're seeing now, and we talked about a little bit before the recording about this, is that they're finding things like kidney disease, heart disease, cancer in children who otherwise have clean records, but were in some kind of a tragic accident. So this is as low as 8-year-olds that get in a car accident, and unfortunately they don't make it. They've had permission to do autopsies, and they're finding, wow, this 8-year-old had lifestyle-induced kidney disease already, or this 12-year-old had lifestyle-induced, cancer, heart disease, whatever, right? And specifically, I have a couple of statistics here that I want to read that you were already familiar with, like, you were already top of mind for you going into today's recording. But when they did autopsies of 200 children, and between the ages of 2 and 15, 10% of them already had plaquing in their arteries. I think there are adults listening to this right now that are still, they're 30, 40, 50 years old and thinking like, oh, I haven't heard anything from my doctor, therefore my arteries must be clear, right? I mean, that's true. We encounter that every day. I thought that for years. I mean, I'll admit, like, for all those years, I'm like, no, I'm 30, no big deal, right? At 16 to 20 years old, 35% of the children had plaquing in the arteries. And anybody who's been autopsied in their 20s, 70% of those young adults had plaquing in their arteries.
What you feed your children before the age of 10 comes up in their teens and in their 20s. You are setting your children up for disease or health.
Yes. And again, I mean, I could tell this isn't the Dr. Bagwell testimonial show, but I have so many, like, I do what I do every day because of the experiences that I had and how I saw it actually creating a negative outcome for my friends, my family, people that are older than me. And ultimately that became one of my biggest motivating factors. And I've talked a lot about my dad's sickness and illness over the years, but I remember, learning about spiked blood pressure and cholesterol and all that stuff. I mean, some of my first memories as a kid are talking about my dad's health and learning about health related issues. Right. And the problem, like I was just alluding to there, is that you immediately went to what you feed your kids, but our healthcare system, or what we call our sick care system, their default is not nutrition. They don't say what you fed your kids, like feed your kids differently. What do? They say, oh, like, we need to treat that. We need to treat that illness, right? Your kid's less than, we need a medication to make them whole again. And even if you don't think about it in terms like that, those words sound extreme to so many people when they hear them, but think about the psychology of a child. They're saying, oh, I can't do it without. And again, that's my story. It's like I just said, oh, you must need pill. I remember I'm looking up as I say it, because I remember looking up on top of the refrigerator and seeing the little cut cardboard box with all the pills in it, all the pill bottles, and just thinking like, okay, that's what you need to get healthy. And we think that our kids don't perceive that, right? But the reality is they don't know a different way of thinking, right? They're very simple in their thinking. So I have some more statistics here. What we talk about all the time, we might be 5% of the world's population, yet we'll consume 75% of all the world's drugs, right? Well, since 1990, medications for ADHD alone for children have gone up 700%. Since 1990. Now it's higher than that, because I taught this 3 years ago, so it's even higher than that now, right? And then at the same time, some of the stats that I share at our dinner workshops is that 1 in 4 children right now in the United States are on a medication. A lot more than that are on medications, but 1 in 4 are on a medication for what's considered to be a chronic condition. So that's nothing. I mean, like how, and so my question is, and I ask everybody all the time, it's just crazy. How can a child be 10 years old and be put on a medication for something that's chronic? They're not even old enough to be chronic. You know what I mean? Like they're not, like, how can you know? How can you know that it's a chronic condition? How can you know that it's not going to resolve? Or how they're literally telling a child at 10 years old and telling the parents, you're going to be on this for the rest of your life.
It's become so normalized, though, sadly. I think, honestly, even like childhood cancer and diabetes, like it's all become normalized. And one of the reasons is, that the children are looking to the adults. I remember a
Mm-hmm.
patient coming into the clinic, and his defining moment on his health, the thing that got him off his couch and the thing that brought him into True Health Center for chiropractic and looking for solutions for his health, was his 5-year-old came up to him, and he was taking his daily medications, and she said, "Daddy, I want my own medications, or I want my own pills." And he took a step back and he was like, "What just happened here?" And he wanted to change the example that he was setting for his kids, because he was setting an example of, or an expectation that taking medications was normal. And he's their hero, right?
Right. Exactly. And I experienced it, so I know it to be true. But I just want all the parents out there to realize that when we do, we know things like they're always watching us. But again, just putting it in order, legacy of health, the most important thing that we can hand off to our children. Like we got to know that they're really watching us in that area, and we have to have the radical transparency with ourselves and radical responsibility, to be willing to make the changes for them, right? And to realize how powerful a position we're in for the thing that will become their number one priority in their life later on, and ultimately dictates the quality of their life. And so, I want to read this quote from a medical doctor. He's a neurologist, and specifically a child neurologist. Okay, this is Fred Bauman Jr. He says this: in 1970, by market strategy, not science, psychiatry, the pharmaceutical industry, and the federal government began calling mental disorders diseases. Now, stop there for 1 second, right? Like, here's a guy saying straight up, like, there wasn't science to support this. This was just a marketing strategy. So instead of calling any mental issues that kids were going through anything other than that, they just called them diseases, and coercing their diagnoses, quote, through the nation's public schools. So they even specifically targeted, they knew where to go to the kids and how to get it to be on the rise the fastest. 200,000 children through this effort were labeled and drugged accordingly. Today, 10 million, or 20% of the nation's school children, are labeled and drugged. It is a heinous crime and a national disgrace. Now, that's about ADD and ADHD, but we could apply that across the board to so many different conditions that now that's an older quote, that now in 2022 we're seeing 1 in 4 children, being put on a medication for something that's considered to be chronic. And so I know, so there we're talking about medications and the medical approach, but let's talk about even, let's put the responsibility back in the parents, and let's go into that nutritional idea. We were talking beforehand about, Dr. Lustig, has a lot of great information when it comes to things like sugar. So just speak for a minute on, on kind of, I guess, the how powerful sugar is and the decline of children's health, really society's health in general, right? But definitely in the decline in health of our children.
Yeah. So, and I'll even just share some obesity statistics. So ages 2 to 5, the obesity prevalence, and these were numbers taken from a 2017 to 2020 study, but 12.7% for 2 to 5-year-olds. They are not even at the age, that's even young enough where they're not even asking for their own food, right? They have no choice at that age. And then 20.7% for 6 to 11-year-olds, and 22.2% for 12 to 19-year-olds. So those are really sad obesity statistics. And certainly I work mostly with adults,
Mm-hmm.
and so I hear the stories, but it is really sad to me that a lot of the stories I hear even go back to before they were 10 years old. And I was just speaking to someone yesterday, and she said that she literally, in her baby bottle, her mom put what's that syrup, like carob
Mm-hmm.
syrup or something. And so she, like, from the start of life, she was getting syrup in her formula, and she was drinking a bottle with sweet
Yeah.
tea. And I have even seen examples where, I actually had a lady come to my house this many years ago, and oh my word, did I get upset, because I witnessed her put Mountain Dew in her, it was like 2 or 3 year old sippy cup.
Mm-hmm.
And I about lost it, but I did take a step back, because I take it as my responsibility is I have that opportunity to have a conversation with this couple, with this parent, and educate her on what that means.
Right.
And Dr. Bagwell, we were having a conversation earlier just about high fructose corn syrup and the tragedy of that in our food supply. But it is not natural. It's not designed for our body to assimilate and utilize
Mm-hmm.
properly. And we even go back to nature. Something you'll always hear us say about food is you eat food the closest to the way that God created it. So that means you're eating an organic apple, and you're eating a whole apple. But what have we done? We have gone and we've taken that apple and we've made it into applesauce, or we've made it into apple juice. Well, that's not the way that it was designed for us to consume. So therefore, our body is not going to respond in a healing way. And that's exactly what we've done, or what the food industry has done with high fructose corn syrup. Is it has been so processed and manipulated. And now when it comes in, and it's in everything, it's in all your children's food. And by the way, they've changed that name too, because all the research came out about how bad that was, and the diseases that it was responsible for. And so now there's many other names from it. So it's hidden in the ingredient list. But that literally contributes to like fatty liver disease and insulin resistance and cellular health and gut health and inflammation. And once again, we're probably seeing that in the baby formulas
Mm-hmm.
that are out there. I have a lot of my patients come to me, and maybe they have a history of having a bariatric procedure or doing medical weight loss. And the number one thing, like shake that they prescribe is Premier Shake. And it's just toxic. It's just
Mm-hmm.
like, it's disguised as this protein shake, but it's just toxicity that has just been put into the body. And I feel like probably a similar thing is happening with baby formulas and children's snacks and drinks and baby foods and things like that. So I am very concerned about the nutrition of our children, and I get to see it 20, 30, 40 years later, where someone is on 7 medications and they're 50 pounds overweight.
Yeah, one of the things we didn't talk about, was vaccination when it comes to what we've done or what we're doing to our children. And, definitely we can do future episodes on that topic specifically. Right now, kids are getting 49 doses of 14 vaccines before they're 6 years old. And it's been shown repeatedly to cause lots of different issues, including things like brain inflammation, et cetera. But I guess the reason, because, now we're talking about like toxicity there a little bit, but to come back to the fructose idea, and also that leads to ADHD, et cetera, et cetera. But there are actual researchers right now that are saying that things like, fructose is being directly linked to heart disease, diabetes, and stroke. They're actually saying that it's causing heart disease, diabetes, and stroke, the fructose that we're dosing into our kids. I'll come back to the vaccine thing here in a second. And then other researchers are saying, no, wait a minute, it's actually feeding cancer directly. right? And so, to the point where that researcher actually completely shut sugar out of his life altogether because he felt like that the research was so definitive about how sugar is feeding cancer cells, like he just shut it out of his life completely. And why I'm saying all these things is because I remembered a conversation that you just made me think of, that a local pediatrician who was anti-vax for all of the right reasons. She actually became a very empathetic, and said, look, you can, I remember at one point she would say, you can, this is a place you can bring your children if you're choosing not to vaccinate. Years later, I went in to do a workshop at that pediatrician's office for their team about stress or whatever the topic was, and brought lunch for everybody. And I was talking to her afterwards, and she's like, we can't tell people that we're supportive of that anymore. And I was like, oh man, why? Because it's always hard to find someone. And parents might listen and say, yeah, it is hard to find somebody, but here's why. The reason why she stopped was because when families were coming in and they were watching them put Pepsi in the baby bottle, at that point, she's like, we could no longer trust the people at large to take care of their health. And so now the liability would then go on to the medical practitioner, right? Because now they're not doing, so now it's like, because the society will crucify the medical practitioner for being anti-vax, right? The government and, healthcare system and all that. And so she's like, now, unfortunately, the people have put us into a position where we can't trust them. So now we have to protect ourselves and go into self-preservation mode so we still have a practice, down the road. So we got toxicity, we got fructose, and if we don't do something about it, and if we don't share these podcasts, if we don't share the truth from the podcast with people, if we're not going to workshops and continually educating ourselves, and we're just kind of, throwing Facebook memes around, it ends up creating a culture that'll do some stuff right, some stuff wrong, and we're backing the good people into the corner, to be able to help us leave that legacy of true health to our kids. And so, yeah, gosh, I totally forgot about that. And you just made me think of it. It's like we have people that are on our side. Like we have people that are fighting for your kids' health at a whole other level that you didn't even know. I mean, medical doctors that are saying, hey, maybe we need to reconsider all the vaccinations that we're giving our kids, right? So we have champions out there, but they're getting harder and harder to find because we're not taking radical responsibility, for our health. Or in the extreme ends, we're feeding our kids Pepsi in a bottle. The kid can't walk and they're drinking, acid with sugar in it. So anyway, kind of crazy stuff there. Speaking of the toxicity issue, I don't want to hit on that before we wrap up today's episode. But we talk about we talk about the high fructose corn syrup, which is toxic to us. It's added to the foods. But I like going over, we shared this many times, but you can pull up ingredients list from most common foods eaten through fast food. Strawberry milkshake is a common example, and there's no strawberries or milkshake in there. Milk in there, right? I mean, there's no dairy or strawberries in there, even if by name that's exactly what it is. And yet there will be a list of 50 to 70 chemicals that make up what's in that cup. So it's literally a cup of chemicals that happens to be perceived by the child or the adult as a strawberry and milk, right, and dairy. And then if that wasn't enough, then before the ingredients even make it to the restaurant to become the milkshake, it's been sprayed by so many herbicides and pesticides, which have been showed repeatedly. I'm looking at a piece of research right here. It's been shown, look, these things that are added to our foods or that the raw ingredients are sprayed with before they ever can become the messed up sugary stuff that we might eat. I mean, it says right here, studies have been found repeatedly to create chronic conditions, even at lower doses, to include things like memory disorders and skin conditions and depression, miscarriage, birth defects, cancer, neurological conditions like Parkinson's and Alzheimer's, if I didn't already say Alzheimer's, memory disorders. And even if that wasn't enough, like by itself, just globally speaking, it said specifically in 8 to 15-year-olds, we see it causing ADD and ADHD all the time. The thing we were just talking about a minute ago, that then what's the solution? It could be either A, stop consuming those things and or stop spraying those things on our kids' food, or B, give them a medication to attempt to manage the symptom, right? And so the fatal flaw of our healthcare system is that it chooses to manage sickness and be a sick care system instead of manage somebody's health.
I think it's so hard. At the time of recording this podcast, they announced the lawsuit against Mars, right, for
Hmm.
Skittles, and now we're aware of just a lot of foods that are just in our grocery stores and in our gas stations and things like that, that candies and crackers that in other countries are banned because the ingredients are carcinogenic. And I just think, like, you wouldn't want your children to smoke or
Hmm.
vape. Why? Because we know that it causes cancer. Well, we also know that glyphosate causes cancer, right? So why are we allowing them to just consume food coloring, high fructose corn
Right.
syrup, and all these toxins that unfortunately are just on the
We'll talk
grocery
about
shelf?
this a lot, and
And that, I
yeah,
guess
we'll
that's
talk
the
about
hard
this a
part.
lot in the solution side too. But that mindset, right? It's like, oh, it's just a little bit. Don't get started on it yet. I want to talk about it on the other, because I know that's a hot topic for both of us. But it's like, oh, it's just a little bit though, right? It's just a lollipop with a little bit of red dye in it, right? So we'll talk more about that. The last thing when it comes to toxicity, we don't think about toxic thoughts. We don't think about, how we don't think about, brain health being like a top of the list because we're talking about heart disease and cancer. But in this clinic and for 16 years, the focus has been about the nervous system first because it controls all other systems. And one of the most toxic things that's happening nowadays for kids that's wrecking their health in a really fast downward spiral, affecting the brain, the thing that controls every single other organ system that's struggling nowadays. And what we're talking about here is screen time, right? How much time our kids are spending and watching movies and games and all that stuff, and glued to their phones. And so, there's this essential stimulus that we have this requirement that we need to flex the muscles of all the different parts of the brain, which happens when we do things like have social interaction. We're having this conversation. When we open a book and we read, then it goes from our eyes through our entire brain, right? And then we get to exercise our creativity, right, in those areas of our brain. So there's essential stimuli in order for us to have proper brain health. And what happens is that when we spend more time glued to the TV or the screen, whatever it is, the iPad, the phone, then what they've said is, and the research is, that it dulls our frontal lobe for good. So we're not developing proper pathways and we're dulling our frontal lobe. Well, we talk about the frontal lobe a lot at True Health Center because this is where this is where all of our social interaction comes from. And how much dysfunction there have we seen in our kids with all these social disorders and social anxieties and stuff like that. This is where we, in that frontal lobe is where we have a sense of community and belonging. Well, how many kids do we have that are suffering from depression and feeling more alone than ever in history, right? Also, empathy. Oh, we talk about like where's all the empathy in the world today? Well, unfortunately, it's been sucked out of this last couple of the last two generations because of the increase of the digital revolution. And also, that's where nonverbal communication comes from, which, by the way, is the majority of communicating. Be able to communicate to another human is over 90% nonverbal, right? And so anyway, there's this huge underdevelopment of proper pathways in the brain and overstimulus of areas of the brain that lead to exactly what we're seeing with many of the mental issues going on with children. And again, what does medicine want to do? What's healthcare want to do? They want to give the medicine in order to treat the symptoms rather than, they want to spend $1 billion to develop the drugs that makes them billions instead of spending just the millions of dollars that could actually prevent it altogether. And humanity actually is better for it. So, gosh, like my heart's just breaking as I'm going through it again right now, because I know so many kids that come into the office, they're subluxated, their nervous system's interfered with, they're chemically interfered with, they're carrying extra 20 or 30 pounds even at 15 years old, and it's just radically changing their lives for the worse. And so, so we're just on mission to make sure that changes. Any final comments before we kind of wrap up episode 1 of getting our kids healthy?
No, I'm excited to go into the solutions on our next episode. This will be really good.
I know you are. That's awesome. So make sure, so that'll wrap up today's episode. Make sure that you tune in for episode 2 of Raising Healthy Children, Raising Healthy Families. just in a week. And so that'll do it for now. Stay tuned, and we're going to cover all of the solutions to include things like how do we help our kids take off the weight, be improved metabolically, better energy, better focus, better brain health, nutrition, all that good stuff. So stay tuned. Thanks for joining us today on True Health Solutions Podcast. Make sure that you click to subscribe. Also, go to our website, www.truehealthcharlotte.com, where you can download any resources related to today's show or any future shows. And lastly, if you search for True Health Center Group on Facebook, you'll be able to join our free health community. We look forward to seeing you there.